Red degeneration of the fibroid, also known as callous degeneration, is a hemorrhagic infection of the uterine fibroid due to the rapid growth usually occurring in the pregnancy. Etiology and the risk factors most commonly occurs during the second trimester of the pregnancy due to the hormonal influence. Increased estrogen and the progesterone can also occur in the non-pregnant women due to the rapid fibroid growth of the vascular compromise. More common in the large fibroids with the insufficient blood supply. Pathophysiology: rapid growth of the fibroid leads to the inadequate blood supply. Venous thrombosis within the fibroid causes the congestion and the hemorrhagic infection. This results in the necrosis and the release of the inflammatory mediators causing the severe pain. Clinical features: acute onset of the severe lower abdominal pain, usually localized over the fibroid. Pain may be associated with nausea, vomiting, low-grade fever, leukocytosis, tender, palpable mass on the abdominal or the pelvic examination. In pregnancy, often accompanied by the uterine tenderness and irritability. Diagnosis: clinical diagnosis based on the acute pain in a known fibroid, especially during the pregnancy. Ultrasound: heterogeneous hyperechoic areas within the fibroid with the cystic degeneration. MRI: high signal intensity on the T1 weighted images due to the hemorrhage, considered the most accurate imaging modality. Differential diagnosis like fibroid torsion, degenerating ovarian cyst, appendicitis, ectopic pregnancy, or the pelvic inflammatory disease, and the abruptio placenta in the pregnancy. Complications like severe pain leading to the preterm labor in the pregnancy, infection and the abscess formation if a degeneration is prolonged. Rarely sepsis if the secondary infection occurs. Conservative management: the mainstay especially in the pregnancy. Analgesics, NSAID or the acetaminophen for the pain relief, hydration and the bed rest. Antibiotics if the infection is suspected. Surgical intervention: myomectomy rarely indicated during the pregnancy unless the symptoms are refractory or the medical management of the complications like torsion occur. In non-pregnant women, myomectomy or the hysterectomy may be considered if recurrent or complicated. Red degeneration is a hemorrhagic infection of the rapidly growing fibroid, often seen in the pregnancy. Most commonly occurs in the second trimester due to the increased estrogen and the progesterone levels. Acute severe lower abdominal pain with the tenderness over the non-fibroid is the hallmark symptoms. Associated symptoms include nausea, vomiting, low-grade fever, and the leukocytosis. Ultrasound shows the hyperechoic heterogeneous area within the fibroid. MRI is the most accurate imaging modality, showing the high T1 signal due to the hemorrhage. Differential diagnosis includes a fibroid torsion, ovarian cyst degeneration, and appendicitis. Managed conservatively with the analgesics, hydration, and the bed rest. NSAID are used for the pain relief. Antibiotics are given if an infection is suspected. Preterm labor is a common complication in the pregnancy due to the uterine irritation. Surgical intervention is rarely performed during the pregnancy due to the high risk. Myomectomy is considered post-pregnancy if recurrent or complicated degeneration occurs. Red degeneration is more common in the large fibroids with the inadequate blood supply. Histology shows the coagulating necrosis with the hemorrhage within the fibroid tissue.